In addition to having powers of attorney, we believe it's very important to have a healthcare directive. This document goes by many different names: healthcare directive, advance directive, physician's directive, or living will. In the old days, this was a very binary document: do everything or do nothing. In the last 10 or 15 years, however, these documents have come a long ways and allow you to give some very nuanced directions about how you want your care to be managed when you cannot make decisions for yourself. You can now direct very different courses of treatment if you have advanced cancer versus dementia. Having a healthcare directive is as much about you having your own choices honored as it is about taking the burden of decision making off of your loved one's shoulders. If you are lying in a hospital bed, you do not want your loved ones having to wonder what decisions to make. What would you have wanted them to do? You want to provide them direction in a written document. Now, a written document is important, but it's equally important to talk about your choices with your loved ones. You want to go over the document with them. You want to talk about the nuances of treatment courses you might want them to follow, so that when they are making the decisions, they might not even need the document. They'll hear your voice in their ears. It's important to remember that if you are able to make your own choices and communicate those choices to the doctors, you're going to be the one directing your own care. You can verbally override your healthcare directive. We saw this a lot during COVID. A lot of older documents said that the person never wanted to be on a ventilator. They got to the emergency room and the doctor said, if I don't put you on a ventilator, you're going to die. The person quickly raised their hand and said, put me on a ventilator, and the doctors complied.